Hello, my name is Cynthia Payne, and I will be presenting to you today a topic that is serious and informative, but that I hope will keep you interested and piqued all at the same time. This presentation is about an outbreak involving antibiotic-resistant strains of Streptococcus pneumoniae in Canada. The case I was presented with was one found in Toronto, Canada, and its surrounding areas. The case initially was brought to attention when a total of 5 people were presented in the hospital emergency room with a symptom of a fever and 5 people with invasive pneumococcal disease. It was found that all 5 of these people held multiple antibiotic-resistant strains of the bacteria known as Streptococcus pneumoniae, as they were able to isolate this bacteria from the patients. If you look at the figure on your right, you will be looking at a highly magnified sample of the bacteria, Streptococcus pneumoniae. Notice that the shape of the bacteria is an fat coccus or circular shape, and where this bacteria is mostly found to be in pairs, the sample shows it can also be found in short chains. Streptococcus pneumoniae is a serious gram-positive anaerobic bacteria that is the leading and major cause of pneumonia and septicemia in adults. The original study we are looking at is not only outbreak of this bacteria causing disease. There was a very similar outbreak in the United States that took place in the late 1900s, early 2000s. However, when it comes to the origin of the Canadian outbreak we currently are studying, it happens to be known as unknown, just like the relationship between the two cases, United States and Canada. The results of the recent outbreak in Canada left 36 cases of septicemia and total of 3 deaths. Later on in the presentation, we'll be elaborating just how dangerous this bacteria is and the diseases it causes, and any treatment that could possibly be used as a defense or preventative, if there are any at all. We'll also be looking into the life cycle of the bacteria itself, as well as the path from colonization to the actual invasion or infection. Streptococcus pneumoniae was isolated originally by Louis Pasteur in 1881. From the saliva of a rabies patient. This is found to be extremely interesting, as Louis Pasteur is more famously known for the pasteurization process we use for our milk and other products today. The Streptococcus pneumoniae is most common among patients above the age of 65 and or below the age of 2. However, there are certain risk factors that can influence your chances in getting the illness from the bacteria. These risk factors, though I will not mention them all, include whether you smoke or overconsume alcoholic beverages. Now, the question is, how many people does this really affect? Well, for every 100,000 people, 36 will have the disease from this bacteria, with a total of 800,000 deaths each year. These statistics happen to cover worldwide bacteria as well, not necessarily just the United States and Canada. When it comes to the composition of this bacteria, it is covered by a polysaccharide capsule that has a cell wall that is composed of peptidoglycan. It is because of this peptidoglycan that when Streptococcus pneumoniae is gram-stained, it is able to retain the crystal violet dye, giving off a blue/purple color, therefore being gram-positive. But where is this bacteria found living? That's a simple answer. We will go into more detail further into the presentation, but for now, its ecological niche, or comfortable housing we could say, is in the nasopharynx of young children and elderly adults. This image we are now looking at shows the incident rate of the bacteria Streptococcus pneumoniae worldwide for children under the age of 5. This is so we can get an idea where exactly this particular bacteria is cause for trouble. Though of course we are still interested in the outbreaks that have been taking place in the US and Canada, according to this map, you can see that Africa has some of the highest numbers for this bacteria's presence. I believe this is to be that they do not have access firsthand to a lot of vaccines that have been created in more developed countries. Though hopefully, after spreading the word about these outbreaks, we can change that over time. I'll leave it on here just a minute so you can take a look yourselves. Okay, now to dive into the more direct information regarding Streptococcus pneumoniae itself, such as how is it transmitted and its life cycle. To start, I think it's important to say and emphasize that this bacteria is actually found to be in each individual all over the world. We are all carriers of this bacteria, and it is found in our nasal passageways. However, it is ultimately the risk factors that lead to other more deadly diseases. So let's go over where it starts and how it gets transmitted. Streptococcus pneumoniae colonization takes place in the mucosal surface in the upper respiratory tract, which allows transmission of this bacteria through nasal secretion, or more commonly known as snot. Directly after colonization, infection typically occurs in the lower airways in the lungs. This is most likely due to a virulent strain of the pneumonia bacteria. As stated in the previous slide, we can see this image, the start to finish essentially of the bacteria Streptococcus pneumoniae, from colonization up at the top, taking place in the mucosa of the nasal cavity, to the invasion or infection of the virulent bacteria at the bottom, which in fact can affect more than just your lungs. It can cause meningitis or otitis media. Let's also not forget or leave out the middle portion of this image particular, and that is actual transmission that will come through snot. So next time you visit your grandma and sneeze, remember to wash your hands. This is where things get a little more tricky. To fully understand, I will explain this in ways that'll be easier. I will start by talking about the basics of how we calculated the relative risk number of the following risk factors. I will use one example to explain the process, and then from there, talk about the risk factor that is the highest. So if you look at the daycare A data, you will use the first two numbers to calculate for E. First, you're going to want to take the sum of the ill and not ill together, 30 and 52, which will give you 82. Then you will take the number for ill and divide it by that sum, so 30 divided by 82. This will give you approximately 0.37. Then you will repeat this process with the non-exposed members, which you will give you the total for F being 0.67. The final step to get the relative risk number is to take E and divide it by F. So 0.37 divided by 0.67, and you get the answer that comes out to be around 0.55. Using the same process, you will calculate the rest of the relative risk numbers to see which comes out to be the highest. That number is 2.54, belonging to the prophylactic antibiotics in the risk factor column. Talking more into the relative risks, the outbreak in Canada actually was most closely related pre-outbreak to its neighboring geographic areas like North Dakota and Iowa and their outbreak. The only main difference between the two outbreaks is simply the protein that the cell's surface carries. But while studying the strands and their differences, they found that the Canadian Streptococcus pneumoniae kept continuously evolving at a rapid pace, so the outbreak continued to spread. Looking at this map here, we can compare the world as a whole and the number of deaths that have occurred in children under the age of 5 due to Streptococcus pneumoniae. This map being the most updated, I could find also can bring to the same conclusion in its sister map on incident rate brought to us back in slide number 6. I'll just give you a minute to look at this as well so you can see the differences and similarities. Okay, looking at the symptoms Streptococcus pneumoniae can cause, you can see that you have to exercise caution. This is because the symptoms are very similar to that of horrible cold or even the flu. Cough, fever, chills, shakiness, shortness of breath, etc. But how do you get tested for it? Is there any new methods? Well, initially, you would need to use the culture methods, which would be a little more complex and could take more time than today. Whereas now, all you have to do is the simplest test on either your blood or saliva and so on. The only other problem about these current methods is that you cannot detect it early on. It takes until you are infected that you can be tested. So scientists are working on a way that they can use PCR methodology to detect it in its early stages, as well as tell what stage it's currently found in. For treatment for patients with Streptococcus pneumoniae, there's an antibiotic therapy, as well as 2 different kinds of vaccines to either help prevent or even treat the disease. For patients that are at high risk of death, they undergo a more serious treatment. So this would probably be your children that are under the age of 5 or elderly folks that are above the age of 65. It is because of these treatments today that more people are able to be treated and live through the diseases caused by Streptococcus pneumoniae. In summary, we walk away from here knowing that each and every one of us is a carrier with Streptococcus pneumoniae, and that it can cause deadly disease if you encounter a virulent strain of the bacteria. We also know that the bacteria is found all over the world and affects many different people. Due to the outbreak in Canada, it is forced scientists to do research and research more effective ways of treatment and preventative for the ever-changing strains. Diagnosing this has become a lot easier, faster, and more efficient now that we can do blood or saliva testing. But there's still more growth that can occur in the time it takes to detect the diseases. There are, in fact, treatment for this, but there are catches having to do with the risk factor, such as age or which antibiotic to use. Lastly, and finally, you can find yourself in a situation where you're going to hold a newborn baby or visit grandma. Make sure you're courteous and wash your hands to prevent this from spreading or cause another outbreak. Thank you so much, and I hope you enjoyed my presentation learning about Streptococcus pneumoniae and the outbreak that happened in Canada as well as the US. I hope it was informative and that you took away something to learn. Thank you very much.